Welcome to Minor Matter Strength and Conditioning. My name is Oscar and I'll be your host. For previous videos and more progressions, please visit the channel. You're going to start by having the towel. You're going to roll the towel. Make sure that the knee that's injured is bent and it's not painful. You're going to place the towel against a wall and have that knee right next to the wall. And now what you're going to push to the inside of the wall and use the towel as a feedback, but also for support and cushion. So you're going to push, contract for 3 seconds, 1, 2, 3, and you're activating your hip abductors, and those muscles help stabilize your knee. So once again, you're going to push 1, 2, 3, and you can continue to do, you can start with 10 repetitions of 3 seconds of isometric contractions. Isometric means that you're using those muscles, but your knee, your leg is not actually moving, so you're still being able to activate those muscles without any damage to your knee. You're going to gradually progress to 5 seconds, and this will help you not only to activate those muscles, but will eventually give you a little more range of motion so you can start moving your knee a little bit more. And you have a yoga block. You can also use a yoga block or even a ball that you can push against, but you just need to have some support. You're going to start with having a resistant band around your legs, around your upper thighs. And what I want you to do is you can perform this exercise either on your back or long sitting with your hands and your chest. Your hands behind you and your chest up. Now all you want to do is you're going to push against the resistant bands by activating more of your abductors, your hip abductors, which are composed of your glutes, but also other muscles that help abduct your leg. Now as you're doing this, you're going to go slowly out and go back in. So you want to always go into pain-free range of motion. So if it's painful out here, don't go out so far, especially if you had a post-surgery a week ago. You might not have that much range of motion, but your body will let you know how much far to go. You want to avoid any pain. You want to always work in a pain-free range. So just doing small little control motions will help activate those muscles to help stabilize your leg. So 2, 3, 4, 5, 6, 7, 8, and as you get better, you're going to gradually move farther away. And I'm going to go on my back to show you. When you go out and go back in. Out and you go back in. So you want to start with 12 to 15 repetitions and gradually build up to 15 to 20. Start by lying on your side with your knees bent and your knees are going to be towards your chest. Now you're going to slowly lift your knee up and slowly bring it back down. You're going to repeat this motion 10 to 12 times to begin. Now the primary muscles working in this exercise is your gluteus medius, minimus, and maximus. You will start feeling it on the outside of your butt. That's very specific to that exercise. Now you want to control the movement by slowing it down. Don't go too fast and prevent your hips from tilting to the side. Now you can start with 2 sets of 10 to 12 repetitions and gradually progress to 3 sets of 12 to 15 repetitions. You can start by moving your leg out to the side. Now move the leg out at a 30 to 45 degree angle, leading with your heel. And you're going to repeat this 10 to 12 times and perform 2 sets and gradually build to 3 sets of 12 to 15 repetitions. Now the primary muscles also here are your gluteus medius, minimus, and maximus. You're going to feel it at a very specific spot on this one, on your butt. So make sure it's not on the side, but on your butt. Now, placing the yoga block will help give you feedback and prevent your body from working other muscles. So if you need help, use the yoga block. So I want you to make sure to, one, keep a pillow or your head for support. Keep the knee that's on the ground towards you, bent. And the one that's being used, make sure it's straight. And make sure your heel is up against the wall. So you want to start by keeping your body a couple inches away from the wall. And the towel helps not only not scratch the wall, but also it gives you a point of reference to go up and go back down. It's just slide your foot up and go back down. And the reason why you're doing a couple inches against the wall, because you're working a specific muscle called your gluteus medius. You have 3 muscle groups. Most people work your maximus, and that's what they know as your butt. But the minimus and the medius help stabilize your hip. So this one's a very important one, especially for women, because when they walk, a lot of them have loose joints, or their structure, the muscles are not strong enough. So this one will really help not only runners, but help you balance a little better. And you should feel it on a very specific spot on your butt. You shouldn't feel it on your side of your hip. You should feel it more on your butt. If you're feeling the side of your hip, that means you're too close. So once again, you want to go away, lift it up. You can hold it for a second, and then go back down. So lift it up, and then go back down. If you're lifting up straight up in the air, you're going to work a muscle called your TFL, your tensor fasciae latae. And that one, you don't want to aggravate your hip, because that one really bothers your hip. You want to work more of your gluteus medius. A lot of people who have sciatic or piriformis syndrome, it's usually because of a lack of muscle strength in your gluteus medius and an overuse of your piriformis muscle, which also does the same thing. But it's usually used a lot because when you're sitting, you're putting all your weight on it. So doing these ones will really help. And once again, you're going to go out to the side. And remember to lead with your heel. So your heel is actually going out. So if this is too much for you, then regress to the other previous exercise if your knee is bothering you. So you can isolate the right side, and you should feel it more on the outside of your hip. And these ones will play a big important role because when you go walking, especially upstairs or downstairs, you're always walking on one leg. So you will want to build enough strength to help support your knee.